Hi everybody, I am Dr. Katie Schmitt. I am the physical therapist here at Hollings Cancer Center. We are here today to take you through some breast cancer exercises. These are all designed for when you're just out of surgery. So this is Joanna. She is our breast cancer warrior goddess. She's fabulous. She's been with us for a while now and is an expert at this stuff. And I'm so happy that you're here to show them all these exercises.
I am thrilled to be here.
One thing I do have to say first is this does not take the place of medical advice. So if you have any questions, if you're going through any of these surgeries, please talk to your oncologist first. They can refer you to PT. Also, if anything is painful, please stop and talk to your doctor about it. All right, here we go. So right after surgery, you're not allowed to do any lifting, any pushing, any pulling, anything over 5 pounds, and sometimes your surgeons even want you to keep your arm under 90 degrees. So this is kind of your first month of stuff. We're gonna start with your scalp clocks. So you're thinking about your shoulder blade as a clock. So you've got 12 o'clock, underneath your shoulder blade you have 6 o'clock, you have 3 o'clock, 9 o'clock, 3 o'clock, 9 o'clock. Here's your clock, all your stuff. The first thing you're gonna do is the easy one. We're gonna bring your shoulder blades up to 12 o'clock, 10 times. 1, 2, good. 3. She's got excellent strength. 4, 5, 6, 7, 8, 9, 10. Beautiful. Now we're gonna bring the shoulder blades down to 6 o'clock. So I'm gonna put my hands right underneath your shoulder blades and you're gonna push down into me. Yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Now we're gonna do 3 and 9. So it's kind of like you're squeezing a pencil in between your shoulder blades. Go ahead and squeeze. 1, yeah. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And one thing, and Joanna, you can comment for sure, that
Yes.
3 and 9 really opens up everything right here, which might be feeling like this after surgery.
Right.
How's it feel to do that?
It's interesting because right now, I've obviously had expanders put in, so I'm not at the double mastectomy portion yet. But when I first started with Katie, that's where I was. And there was a lot of tightness, there was a lot of tingling, there was a lot of swelling and lymph.
A little bit of lymphedema in there.
So when you're doing these, it may look like it's really easy and I'm doing it, you know, very, very easily. It's not. So don't be disappointed, don't be frustrated when you first start this if you can really only even go like this or even just go a little bit, because it will pull, it will be a little uncomfortable. Just make sure that if you get any burning sensation, if you get any like, don't overextend, only go as far as to feel that nice, comfortable stretch. And that way you'll be actually doing the exercise and not overextending yourself.
Yeah, definitely. Once you get really good at 12, 6, 3, and 9, you're gonna squeeze 5 and 7. So you're bringing your shoulder blades down and in.
That's the hard one.
This is the one that really gets your scapula moving and is gonna help your shoulder stay where it's supposed to be. 4, 5, 6, 7, 8, 9, 10.
And that pulls across the midline. So that may be a little uncomfortable at first as well.
And like she said, small is fine. You're just getting the muscle to activate. Now we're gonna move on to the shoulder itself. So from here, you're gonna do your I's, your Y's, and your T's. So you're moving your arm in the motions that it has. You wanna check with your surgeon and make sure that you're okay to move into these ranges. Sometimes they want you to wait a certain number of days or weeks. All right, we're going I's 10 times. Good. When you bring it up, squeeze 3 and 9. Yeah, 2.
You're right, because it is easy to round, because you're going to feel pain, you're going to feel discomfort, and you don't your initial instinct is to round, but you're so much better putting your shoulders back and really truly using your shoulder blade, your shoulder joint.
For sure. A lot of times with this, it's range of motion is an issue. If you're here, you're only going to be able to lift your shoulder up to here, but if you practice being here, you can lift your shoulder all the way up. I'm not counting.
I didn't either.
We'll call this
We'll call
10.
this 8.
Okay, I like it. Beautiful. All right, now you're gonna go into your Ys and you're gonna squeeze 5 and 7. So as the arm goes up, the shoulder blade comes down. Yeah. How's that feel?
Different, but good. This really kind of pulls a lot in your back, so it's not really attacking the front of you. It's kind of a nice little rest.
Good.
But it stretches nicely through your back and through your shoulder blades.
That's 10. Beautiful. Now the last one is your straight abduction. So you're gonna bring your arms out to the side. You're gonna bring, and you're gonna turn your thumbs up to the ceiling. Perfect. Up and down 10 times. Good. When you get to the top, think about pulling the shoulder blades down. You don't want just the upper traps. Yeah.
And you probably can't hear it, although maybe you can. My shoulders are crunching. And it's
normal.
Perfectly okay.
Yep, a little clicking and popping
click,
is
little
normal
pop, yep.
as long as it's not painful.
Not
if
at all.
If it's painful, let
Stop.
us know.
Also, when you're doing these exercises, make sure you have a really good support bra on with padding to, am I going too high?
No, you're good. That's 10.
Oh, okay.
But I interrupted you.
That's okay. No, just a good support bra with padding. I'm wearing something called 32 degrees cool because it also wicks away moisture. And it's got removable pads so that you're kind of, you can wear it at all kinds of different stages of treatment. And it's got a nice low band so that it's not creeping up into places where it shouldn't.
Yeah. That helps too with any of the lymphedema. It helps push the swelling out of there. It gives you enough support, but it's not compressing in case you have an expander.
Right.
And it's helping you feel like you're safe to do your motion.
Yeah, because I wore this right after my double mastectomy, and I've worn it through all the expanders, so.
Yeah.
I'm very comfortable at all stages.
Take a deep breath. Good. That's the last exercise, is just making sure that you breathe. A lot of this will get stuck here, so you just want to do those nice open deep breaths. And with any of the I's, the Y's, the T's, you're always breathing out on the work. How do you feel?
I feel good.
Fabulous.
I feel fabulous.
Thank you guys for watching along. You can
you.
do this with us. It's 1 set of 10 at first. You're going to work your way up to 3 sets of 10. You can do it 2 to 4 times a day for about the first month that you're coming out of surgery. And then at that point, you'll talk to your surgeon and you'll be able to progress, and you'll check out our next video.
Yay. Thank you.